demonstration for the panoramic comp, and I have Courtney here who's going to help me do this. Okay, so first thing we did was we turned on the unit and we turned on the digital x-ray. I'm going to let you show them what this looks like. And this is what it would look like if we were really taking a digital picture on the screen. Okay? The next thing that we're going to do is we're going to turn this unit on, and it's up underneath here. We turn this whole unit on. It makes a noise like that, and then we're able to go ahead and we're able to move this up or down. Okay. From there on out, I'm going to go through showing you what we would do with the patient. Hi Courtney, how are you? Come on in. Okay, today we're going to be taking a panoramic x-ray on you. It's something that goes around your head. It's going to take a picture of all of your teeth at one time. Have you ever had one of these taken before?
Yes.
You have. Okay, so you're familiar with it. Okay. Is there any chance that you might be pregnant?
No.
No. Okay. In order to take this x-ray, I do need you to remove anything that you have from the neck up that could be metal. So any bobby pins or necklaces or partials that you might have, we'll have to take those out. Do you need help getting that off?
No, I got
You
it.
got it? Mm-hmm. All right, just be careful that you don't lose it if you put it in your pocket. Okay. I'm going to go ahead and put this on for you. You want to just turn around for me so that I can latch it in the back. Okay, and then turn around this way for me so I can make sure that it's up as far as it needs to go. Okay, that's good. All right. And what I'm going to go ahead and do now is I'm going to place the barriers, and my hands are going to be clean. I could have done this before I did all this with her, but I want everyone to go ahead and see how we're doing this. Now the barriers that we're placing with this unit, we're going to place one on the chin rest, and we're going to place one on the handle that emits the radiation. Okay? And then we are also going to put one on the bite block. And we get those in here. Okay, now before I actually put Courtney into the machine to take the x-ray, I am going to glove up. This is in case you have to guide her lips towards the bite block or anything. You already have your gloves on. Okay, now the machine is basically ready, and you can't see on this side, but the control panel is on this side, meaning that it's ready for her to step into. And what I'm going to do is guesstimate her height. So I'm going to push the black button, bring it up a little bit. I'm going to have you come on in here for me, okay? All right, come on in and place your chin on the chin rest here for me. Okay, it's still a little low, so I'm going to bring it up a little bit. Okay, go ahead and take your hands and hold on to these handles for me. I want you to take about a little bit, about 2 inches in, step. Keep your feet together. Keep your shoulders down, okay, knees straight. Keep your chin on the chin rest. And then what I want you to do is open your mouth and bite on the edge of that stick where, there you go, until you feel that little bit of a notch where your teeth fall into, okay? Now Courtney is not quite down enough. She needs to be tipped about 5 degrees downwards. So Courtney, as I move you, just move your forehead in. Just like that. Perfect. Okay? All right, now what I'm going to do is turn the lights on. which are going to give me the planes to make sure where I am. Now what I want you to do is look in the mirror and move your head until that line going down the center of your face goes through the center of your nose. Okay, I'm going to move this until I get it. Go ahead and make a smile for me. Okay, till I get it to come through where your canine is. And then I'm going to move this one until I get it to come through where your tragus is on your ear, or your mid-sagittal plane. Okay, that's good. Okay, now what I need to do for the buttons is I need to hit the ready button, which is an arrow. You want to come over here, Meshach. I need to hit the ready button. This doesn't actually take an x-ray of Courtney, but it gets it ready to simulate it. Okay, now Courtney, I'm going to come out of the room. I'm going to press this button. It's going to take about 30 seconds. It's going to go around your head. Keep your placement just like you are. Go ahead and swallow. Put your tongue on the roof of your mouth and close your lips for me. Okay, keep your shoulders relaxed. This is going to take about 30 seconds. And you come out of the room, but you still watch your patient. Okay? If that were to happen, just... Alright, what I want to do is show everybody, there's two buttons here. When you push this one, it turns off the radiation. This is the one that you have to push if you're the first one using it in the beginning of the day. Okay? When you push this one, it's going to beep at you. And it's going to give you a kilovoltage and a milliamperage number, meaning that you're going to emit radiation. When you push this one, it goes to 0. Okay? Now we're ready. And now when I go out, I'm going to hold the button. It's going to rotate around her head. And you see the zeros, that means no radiation. Okay, now as I come in, I'm going to hit this button because what it does is it brings it back so that she can step backwards. Go ahead and step back for me, Courtney. That just fell off, that's okay. All right, I'm going to take this off for her. Thank you for being so patient. And you can put your hair bobby pins back in. I'm going to lay this down because this is considered contaminated. I'm going to take off my contaminated products since my gloves are already dirty. I'm going to hang this up. Okay. I'm going to hit this, which is going to get it ready for the next patient. I know my gloves are dirty, but that's going to be one of the things that I'm going to wipe down. I'm throwing away these gloves. Going to hand sanitize. And I'm going to wipe my room down and get it ready for the next patient. Now this is a digital unit, which is why if there was a patient in here, this would bring up the whole digital image of the Panorex, and then you would actually bring up the digital image in the operatory where the patient would be. I'm going to wipe down everywhere that the patient could have touched, even though there were barriers on there. I'm going to wipe down the board, and I'm going to wipe down this. Okay, don't forget to wipe down your lead apron as it's been around your patient's neck. Okay, and this can be hung on the wall. It can never be folded, so this is why we have it laid out this way. Is there anything that I could have forgotten? You to study for your protocol for your competency, okay? And the buttons that we're going to use are the buttons that I used today with the ready and the test. So please remember to look at that part of the video if you're having issues. Please remember to talk to your patients as if they are really having this done, even though they're your student partners. Please remember that this is an important part of learning how to talk to your patients once you go to your clinical sites. Thank you.